Hello,
Hey.
everyone. Hello, everybody. Welcome to Tea Time with Double D. There's my handsome husband walking in the background when he's supposed to be disappeared. But anyway, welcome to Double Tea Time with Double D. I'm Double D Mova. I hope y'all got y'all teacups because we're gonna have a good time tonight, and we have a very special guest here with us. We're running a little bit behind. I had a baby shower I had to do earlier, and it ran a little bit late, but I'm so glad it looks like you people are coming in. So you players are coming in here. So y'all waited on me and I really appreciate it. So I'm going to introduce you to my special guest. And if you are following me on TikTok, I'm pretty sure you know Dr. Tiffany Nyberg. Yay! So
Hey,
excited.
everybody.
Dr. Tiffany here with us to run down some things about COVID, help us be a little bit more safe with COVID, and also we may talk about some of the anti-trans bills that are being introduced in these states, and in some states they're passing, but they're getting major objections in the courts. So, Dr. Tiffany, so excited to have you here with me, girl. What's up?
Not much. I'm really glad to be here. Thanks for having me on. It's been it's been quite an adventure. So
Yes, yes, it has. Dr. Tiffany just joined TikTok about a month ago, I guess you would say.
it's about 7 weeks, I think. Yeah.
Yeah. Joined TikTok with us. She's joined the chaos of TikTok. And I believe she got hooked because I swear I see her videos on my FYP every day. And I'm like, go Dr. Tiff, because they're always really good videos. So, what brought you to TikTok? Are you enjoying TikTok? Like, tell us.
Well, I was actually seeing your videos that brought me to TikTok, and when you made that first those two about me, I made that account and signed up, and about I think like 100. When you boosted me, like 100 of your follows came over, and they were really cool and supportive. And so I actually decided to keep making them. And it turned out that I think I'm getting okay at them because people are actually watching them. So
Yes.
yeah, I'm hooked. So
Yes, you're awesome at it. I enjoy every one of your videos. I missed a few couple of days seeing your videos because I had all this crap going on. So I had to go back and binge watch like 4 or 5 of them. Very interesting content. Love when you did the one where you asked people to put questions and then you came back and you answered some of the questions. I really enjoyed that. That was a those were really informative TikToks. So, Dr. Tiffany, tell us about yourself and just a little bit about yourself.
okay, well, my name is Tiffany Alexis Nyberg. I am a board certified emergency physician. So I have been in practice for 18 years. I did my residency at LSU Emergency Medicine in New Orleans at Old Charity back in the day. That was 03 to 07. And since then, I have been a practicing ER doc at Oshner Main Campus first, and then St. Francis and Monroe, and now in DeRidder. I also own a business called Urgent EMS, which we are headquartered in downtown Shreveport in the American Tower building at 401
Oh,
Market Street.
awesome, awesome. You mentioned charity, and I love that you. So you did your residency at Charity Hospital in New Orleans.
Yeah, yeah, well,
That's freaking.
the first half, Katrina kind of messed
Yeah,
up
yeah.
already being repair, but yeah, you know, I was there while it was still the gigantic active institution that it used to be.
Tiff, that's freaking awesome. I didn't know. Look, I didn't know that. I didn't know that you did some of your residency at Charity Hospital in New Orleans. That's awesome. Um, I just know a little bit about Charity from the Hurricane Katrina coverage that I saw um, um, after Hurricane Katrina, of course, and I learned a little bit about Charity Hospital, one of the largest hospitals in New Orleans. Correct? Did you freeze?
I'm sorry, that last part had a little bit of interference. I'm
Oh,
sorry.
okay, that's okay. Charity is one of the largest hospitals in New Orleans. Well, was the one
Yes.
of the largest hospitals in New Orleans.
When I was there, it was the busiest emergency department in the country. A quarter of a million patients came to the ER every year while I was there. So, and
Wow.
that I think that's still a standing record. Actually, I believe. I'm not 100% sure, but that's why I went there. It was considered one of the best places in the country to learn emergency medicine. So, heck yeah.
Aw- Awesome. Awesome. Um, so we're just gonna get and then urgent EMS. How is that going for you? Is it starting to pick up or is it a little slow start or how's that
It's
going in
it's
Shreveport?
it's still a little bit slow, but it is starting to pick up a little bit. And we are getting the word out pretty well. Those the videos and stuff have actually helped a lot with that. Sort of those billboards I put up in Arkansas. Um,
Right. I thought that was so badass. I was so proud of you when you did that. I was like, oh my God, that is freaking badass. For everyone that doesn't know, Tiffany opened a urgent EMS in Shreveport, Louisiana, which is near the Arkansas border. So when the anti-trans bills were actually being passed, she actually put up, well, they actually had already passed. She put up these billboards right around the state legislator office, correct? So every time they would walk outside, they would see these buildings that had Dr. Tiffany on it, and she's offering health care for the trans youth, and that is and they were trying to ban health care for trans youth. But there was Dr. Tiffany right there in their face saying, "No, you can't do that. Let them come on over to Shreveport, Louisiana, and we'll take care of them. We don't play that here." And I loved it. I absolutely loved it.
Thank you.
So, so we'll get into COVID. This COVID deal here has gotten really out of control, Tiffany. Dr. Tiffany, I am, I'm saddened by the level that people didn't get vaccinated. I'm saddened by, to me, the lack of the lack of care, in my opinion, for our fellow neighbor to not get vaccinated, as well as people not taking this seriously. I don't think people take COVID seriously until either they get sick or someone really close to them gets sick. And then sometimes, depending on the level that they are indoctrinated, they still don't take it seriously. Right now, this Delta variant is just really it's really going it's going crazy. It's really so really bad right now. I just read that Florida had 121,000 cases of COVID come down just today.
Oh God.
121,000 cases in the state of Florida. Of course, they don't know if those are all the Delta variant, but I mean, they say that
They will be.
yeah, yeah, because it's supposed to be more contagious than than regular COVID. So, Dr. Tiffany, I would like for you to tell us some of your experiences. Well, first, you can speak about COVID and tell us some of your experiences in the ER, what you're seeing with people who are coming in that have COVID. Have you haven't had any experiences with people? I've heard some doctors say that they've had experiences with people who come in with COVID and they want to get the vaccine after they already have it and different things like that. So I would really love for you to talk about it.
Yes. Look, I've been literally frontline the entire time. All four surges I've dealt with. Okay. Of course, this one's just starting, so and it's still early days on it. Although I'm about to start a 4-day stretch. It just the thing is each one was a little bit different. The first one was scary as all get out. I mean, just because we didn't know what we were dealing with, we thought we were all going to die. Um, and the mortality rate was really high in that first surge, but it was also quick, and it really wasn't that high as far as volume. And the second one in the summer was a bit more sustained. It seemed to just last forever. Um, but it wasn't really that much more busy. It was just, but there was a bit more COVID on that one. The one in January was just hell. Um, because that was just legions of it, and this one's already at the level of January. So
Is it? Is
here,
it?
yes, here in almost every area in Louisiana, it is at, near, or above the level of the peak of the surge in January.
Wow. Wow.
And
So, go ahead.
in I believe Shreveport, Bossier City, Monroe, New Orleans, and surrounding areas, and Terrebonne Parish, um, most notably, um, they are equal to or higher than the surge. Terrebonne Parish is far higher than the surge. New Orleans is getting as high as its initial surge, which caused a whole mess of that.
Wow.
And remember, 3 weeks ago there was 500 cases.
Yeah. Yes. Wow. I need to correct myself really quick, guys. It was 21,000 cases in the state of Florida in one day. So correct myself on that. I said 121,000. I meant 21,000. So
Yeah,
that's still that's the highest.
still
I mean, that's
horrific.
still bad. Yeah, exactly. So, Dr. Tiffany, when these people when you treat people for COVID, like they come in, they have COVID. When I had COVID, I wasn't admitted to the hospital or anything. I was just I was diagnosed and then I was sent home. So what would be a level in COVID that they have it that they would be admitted? Like what would determine that?
Usually, most of it's based off of oxygen saturation, your blood oxygen level. Okay,
Mhm,
if you're requiring supplemental oxygen, if you're requiring extra oxygen, whether it's by nose or face mask, you're, and you're not normally on that at home, you're
mhm,
likely going to get admitted. Okay, it's especially if you're say there's some situations now when the surges have been real bad. There have been times where people only need a little bit of oxygen do get sent home with oxygen, which is something that would never happen in non-pandemic times, by the way. Um, but if you're requiring extra oxygen or you've got some kind of organ failure, you generally get put in the hospital for COVID.
mhm,
Sometimes there's a few times where you'll see a chest X-ray that is just riddled with what we kind of call COVID popcorn,
mhm,
and but they're still looking pretty good. Um,
mhm,
and there have been a couple of times if their X-ray is especially horrific, sometimes we'll be able to admit people. But beds are
mhm,
at a premium, though. Okay,
mhm.
there's no beds left in the state.
Wow.
A week and a half ago, I had to transfer two patients to New Orleans from DeRidder. That's 4 hours by ground because that was
Wow.
the only space available. They didn't have COVID either, just their regular medical problems,
Wow.
specialists. So
Wow.
every
So
hospital closer was full.
so what do you think, Tiffany, Dr. Tiffany, about y'all? I'm sorry about I keep trying to call Tiffany Tiffany because Tiffany is my friend in real
Yeah,
life. So
that's like you're my
I
friend.
want
We've known you. We knew each other even before I was out officially. So
okay.
you can
So
call me
I keep messing.
Contact.
I want y'all to know that I keep messing this up because Tiffany is my friend in real life, and that's why I keep mumbling mumble jumbo over my words and trying to keep professional and calling her Dr. Tiffany. But I just want to call her Tiffany because she's my friend on a personal level. When I call her and ask questions, I'm saying Tiffany. But anyways, so I saw a TikTok that you made the other day, and it may have been a week ago or so. And you were speaking about how you didn't think you could go through it, another surge of COVID. You were very frustrated. I know that people in the healthcare profession were treated so poorly, with having to re-wear masks for days on end, in those other surges. Tell me about your frustration and why you made that TikTok that you made.
Because honestly, the look, and I was in the Superdome during Katrina. Okay, so my benchmark for bad is not an ordinary benchmark. Okay, um, this has been the worst experience in my career in medicine. The pandemic. Okay, it's endless. Okay, um, the it's mostly been dominated by fear of getting COVID, fear of dying, fear of this never-ending fear of passing out because you haven't been able to drink for the entire day while you're on shift because you're wearing your N95 because you don't want to take it off and get infected and die. I mean, it's just and this endless fear and also fear for your patients, watching them all gasp for breath and The worst part about it is when people die from COVID, they die gasping for breath, terrified, alone in a hospital room. They don't even get
Yeah.
to have their damn family with them because it's too much of an infection risk for everyone.
Right.
So, and something that bothers me is just watching people be terrified. I just can't. I hate it, and
Right.
and it breaks my heart. And you know what? And I can see my coworkers, the nurses that I know and work with, and that I'm friends with. They're half of medicine is having mental breakdowns right now. Because
Hmm.
we're just getting flogged over and over to keep doing this, and we can't quit because there's no one else to pick it up. Okay,
Right.
a lot of people have already quit. A lot of people have been killed, from by COVID, and a lot of people are permanently disabled. We've lost probably 10% of our medical workforce,
Mhm.
and so we're having to do more with less, and with people who are angrier at us,
Right. Right.
and and,
Um.
and there's just so much you can take.
Right.
And,
I'm sorry, Tiffany. I'm sorry, Dr. Tiffany. That. I got some chills over me as you were explaining that. It really, and I'm wondering. My next question to you would be: does it make you angry when people don't take COVID seriously because you are seeing it firsthand and you know how it affects people and families and also the healthcare professional profession as a whole? You know how it affects. So how does it make you feel when you see people that saying, I'm just not getting vaccinated, I don't care, that sort of thing?
some people who are against getting vaccinated are following, and they're doing so because they're scared, because of misinformation. Other people are actively spreading it.
Hmm.
Those people, the ones that actively spreading it, infuriate me.
Yes.
I wonder if they ever stop to think that maybe all these nurses and doctors that keep begging them to do this aren't doing it for political reasons, but because they just don't want to see them die. That's
Correct.
it. That's why we went into medicine.
I never understand why people like these people. Some of these people are so indoctrinated that they don't even listen to healthcare professionals. The politics of it all overtakes the actual doctors and nurses that are working on the front lines that are seeing this. Look, it's real. Do what you can to protect yourself. All of this for a paper mask. Everything that's going on is for a paper mask over your face. It doesn't make any sense. I'll never be able to understand that, Tiffany. I'll never be able to understand how, if you don't have any care for yourself, how can you not? How, if you don't care for your fellow man, you can't have any care for yourself. I mean, it's just ridiculous. Um,
And you know what
and then
else?
the long term. Go ahead.
COVID COVID doesn't give a rat's ass what your political party is. It doesn't
Exactly.
care who you voted for. It doesn't care what you believe in. It doesn't care whether you love your family or you hate them. It doesn't care whether you have a job or you live under a bridge or you're an astronaut or whatever. It just wants to infect you and make more copies of itself. That's it.
Right.
And if it kills you, say la vie. It doesn't care.
Correct.
Whether you believe in it or not, it is what it is. It is
Mhm.
our duty as human beings to deal with it and not harm our neighbor by our actions.
Right. Someone just left a
Sorry.
comment. I, hey, I concur. I concur with your sentiments there. I concur. Someone left a comment here, and I want to put it here on the screen. And they say it's getting harder and harder to have empathy for adults who won't protect themselves and others. I have to concur with that comment as well. Ray, I don't know. I'm gonna just call you Rave, Raven, maybe Raven. I have to concur with that comment. Um, it is getting harder. I do this thing on my TikTok where I say play stupid games, win stupid prizes. And uh, my TikToks are crazy. So I do the play stupid games, win stupid prizes thing. And I had one that I had. I thought to do play stupid games, stupid prizes, and I did not do it. It was about a police officer that spread misinformation about COVID, and they ended up dying. He ended up dying from COVID.
You've heard about
After I did that TikTok, everybody was under there. Why didn't you do play stupid games, win stupid prizes? I'm like, I just can't. I just couldn't do it. I said, I feel like that just would have been too much because honestly, if someone at the end of the day, someone died because of all the misinformation that's being spread about COVID, and it's ridiculous. If people want to know, Tiffany, why is there? Okay, so we got vaccinated, and I know you're not an infectious disease specialist, but a lot of us got vaccinated. Right now, we have what 67% of the population that's vaccinated. We have this Delta variant that has came that is contagious, more contagious than the first variant. So we have people that are getting COVID even though they are vaccinated. Now, the first thing I will tell them is that you can still get COVID even if you are vaccinated. But why are they asking us to wear the mask? Do you think that eventually there's going to have to be a booster shot? And do you think a booster shot is going to be effective?
Okay, so the way immunity works from shots and natural immunity, although natural immunity with COVID is not as good as we would like it to be, but the way immunity works with COVID, it's kind of like a fire alarm and sprinkler. Okay, so you can still the thing about that is you can still get a fire in your kitchen.
Mm-hmm.
Okay,
Mm-hmm.
the fire alarm will go off, the sprinkler will go on, it'll put it out. You know, but you still had a fire in your kitchen, okay?
Correct. Mm-hmm.
If you Because the only thing that matters for that is that enough heat get focused in one particular area to make things burn.
Mm-hmm.
And COVID, if you inhale enough viruses, eventually you will overwhelm fire retardant. You will overwhelm the immunity, and you'll get a breakthrough infection. Now, those
Mm-hmm.
infections aren't as severe as regular COVID infections. You know, although there's been something like 128,000 breakthrough infections, and that sounds like a big number, and they had it in red on the Drudge Report yesterday. But keep in mind, that's out of 164 million plus people. Okay,
Mm-hmm. Mm-hmm.
164 million. That's less than 1 in 1,000, and
Right.
the number of dead is under 1,400. That's less
Right.
than 1 in 1,000 of those cases.
Mm-hmm.
So your
Wow.
chances of actually dying once you have the COVID vaccine is 1 in 1,000. 1 in 1,000 times 1 in 1,000. What is that? That's like 10 million or something, um,
Yes.
or 1 in a million, I think. Or
Right.
it's or what? Even if it's 1 in 100,000, I mean that's like lottery odds. Okay.
Yes. Absolutely. Someone had a question here and they're asking, Michelle, my belle, is here, who's always here. Love you, Michelle. Thank you for coming. I didn't expect you to be here this evening. Michelle is always here. She loves me. Any tips for boosting the immune system to help fight it? COVID, I'm assuming. Tiffany, that's for you, not for me. I'm not the
Vaccine
doctor.
would really well.
Mm-hmm. Okay.
It's breaking
If
up a
you,
little bit. I'm sorry.
oh no, you're okay. Am I okay now? Tiffany? Uh-oh. Tiffany's frozen.
I'm sorry.
Tiffany? Tiffany? Tiffany, wave your hand. Yeah, she's frozen. Hold on, y'all. Give her a minute. Tiff.
Okay.
Tiff.
Yeah, I'm
Yeah,
trying.
there we go.
It was
There
I
we
couldn't
go.
hear it.
You're good,
Okay,
Tiffany. Can you hear me
I can hear
now?
you now. Okay,
Okay, we're all good. We had a little snap. We had a
I
little
can hear you
snafu.
better
That's
now.
okay, good. Okay, you're good? Did she freeze again? No, I just saw her blink. No, she left. She's gonna have to re-click and come back in. Tiff, hold on, y'all. Give us 1 minute. Hopefully she clicks and comes back in. There she goes. Okay.
Okay,
Hello.
Yeah, I'm using the worst wireless in the world at the Best Western instead of the apartment that I was supposed to be at because
Right.
once again, the third time in a row when I came down here, it was broken. So, but I'm sorry, I'm about to pull my hair out.
No, don't be, don't.
Um,
It's okay. We're having a good time. It's okay. Don't worry about it. We okay. You look frazzled. Calm down. Shake it off. It's all right. Okay. It's okay. So, she said, someone said, okay, so we have Michelle that said, any tips for boosting the immune system to help fight it, COVID? And you said your suggestion, of course, is to get the vaccine.
yeah,
Mhm.
because taking vitamins isn't going to be covered.
Okay. Okay.
Okay, I know that's
Um,
real popular right now, but I've never seen anyone. Everybody who comes in, so they with COVID, they say, "Well, I've been taking all these vitamins." Well, because there's no substitute for an actual immune system and actual antibodies, that are easily available. So,
right.
if you get good sleep and you eat well, your immune system might function 5% better. But remember, we're talking about something that on a bad day can overwhelm, the best vaccine medicines ever created. Okay, your immune system
Right.
doesn't stand a chance.
Right. Right. So
Uh,
we're suggesting everyone get vaccinated. Get vaccinated. I know all my players got vaccinated, but if there's anybody out there that has not, we're encouraging you to get vaccinated. Dr. Tiffany has a lot of experience seeing people with COVID. She worked all the surges and is currently working the surge now, and it's been terrible. Um, and we can do our part. Why can't we do our part? I don't know. Do you feel like Dr. Tiffany, that if more people had got vaccinated, it would have been enough time for us to develop herd immunity? Like if more like 80%?
well, I mean, look what happened in Great Britain. Okay, they caught fire with Delta too. Okay, they started
Mm-hmm.
burning big and bright. Okay, it
Mm-hmm.
looked like it was going to be the big disappointment that because they had like 85% vaccinated. Okay,
Mm-hmm. Mm-hmm.
Delta, and then Delta, their surge died off without any further action because those 15% that were unvaccinated got COVID, and maybe 5% of the vaccinated ones did. But after it was done, after that happened, there were the another analogy I use is COVID is getting vaccinated. It's like having a forest that's forest fire COVID, okay, and being vaccinated is like having a heavy rain in the forest, okay, and no drought,
Mm-hmm.
okay. You can still burn a tree, but you're not going to kindle a huge raging California style wildfire that way. Okay, you're going
Right.
to burn a couple of trees and it'll go out on its own because
Mm-hmm.
it's prepared.
I agree. I agree.
So, and that's what happened in Great Britain. I think that we could have done it ourselves, but and it's just so dismaying. Even right now, I mean, a lot of the things we're just asking somebody to put a piece of cloth or paper over their face that costs like 50 cents, and maybe stand
Mhm.
6 feet away instead of 4 feet away from somebody. I mean,
Right.
look at it. How much effort does that take? I mean,
It doesn't.
is that inconvenience worth your neighbor's life?
Right. Right. I wonder why I just don't understand why it's so hard for people. I'll never understand it. People have been completely indoctrinated in this situation, and I just feel sad. I just don't know where do we go from here. As we know, President Biden has offered the incentive. Well, he's not offered. He's encouraging the states and local governments to offer $100 incentive for people to get vaccinated. There has been incentives in almost every state, I believe. Well, not almost every state, but most state to get vaccinated. We have governors that are fighting the mask mandates, fighting people, saying they're going to fine government businesses for imposing mask mandates and stuff like that. That's Greg Abbott, Ron DeSantis, people, Texas and Florida and places like that. We have Governor Kay Ivey of Alabama that's now blaming the unvaccinated, but she was one of the first ones to get rid of the mask before we had even before 10% of the population had been vaccinated. They were just vaccinating the elderly when they let it go. So now we're in this hot spot again, and I really don't know what we're going to do, Tiff. It's looking pretty bleak at this point, and I'm hoping that you are okay and that you will be okay through everything, because um, I know it's hard for you all that work and see this firsthand every day.
We have to keep trying, though. Okay,
Mm-hmm.
because
Yes,
you know what the vaccine has done in the U.S. so far? It's prevented 275,000 deaths. Okay, that's the
correct.
number that would have died if we hadn't done anything. Okay,
Mm-hmm.
so what we did made a big difference. That's almost the population in New Orleans right there. Okay,
Right.
you know, we could have had it could have been much worse, and
Mm-hmm.
it can still be much worse. We can still save a lot of lives. Okay, we can still. There's always something to save, and
Mm-hmm.
we can still do it. We can still pull back from the brink. We're still going to get a surge. It's too far gone not to get that, okay? But we don't have to throw gasoline on it. You know,
Absolutely.
the fire's burning. We don't have to use flamethrowers, okay?
Absolutely.
We can,
Absolutely.
in this case, the waters, the masks, the social distancing, the vaccine, having remote learning for the kids during the worst of the surge. Okay, I'm not talking about canceling school for another year. I'm talking about maybe having 4 to 6 weeks of remote learning when it's peaking in their communities.
Mm-hmm.
Just common sense things that just back it off a bit. And
Right.
stop. And we need to, and honestly, I have my own political beliefs, but I'm not really going to actually go into them because they're not relevant to the practice of medicine. And
Right.
it does not matter.
Mm-hmm.
So we need to be human beings on this one. We need to look at each other and remember that, one of the better things about humanity is that we are our brother's keeper, okay? That we do care about each other, even
Correct.
when we might argue at the dinner table, okay?
Correct.
When it comes back down to it, though, each one of us, each one of them that isn't getting the vax, okay, their lives are precious too. Their light's shining in someone else's darkness, okay? Their fathers, brothers, mothers, sons, daughters, that there's something to someone, okay? Human lives are always worth fighting to save. Always.
Beautifully said, as usual. Beautifully said, as usual. Love it. Um, we have a question here from the audience. I don't know if there's an answer to this. I'm not in medicine, so I'll put it up here. Michelle would like to know, how long does the vaccine last?
We don't know that one yet. Um, it it lasts through now. Okay, for people, it lasts a year at least. Okay, we're pretty certain of that, because even not talking about the people who got it in December or January like me, but the people who are in the testing groups. Some of them got it as early as you know um, June or July. Which why it was available early for them to do tests is because they were already working on a coronavirus vaccine, like a general one. So when this came out, they had like a super running head start on it. That they probably, if this hadn't happened in 3 years, they would have actually come out with that because they would have taken their time because there wasn't any rush back then. But they were doing it
Right.
because it was SARS and MERS that actually got them looking at making the coronavirus vaccine because it was the most likely. It has been considered the most likely virus besides the flu to cause a pandemic for a long time.
Wow. Wow. There was a CDC leaked slide yesterday from the CDC that said that it was more contagious as
Okay. Yeah.
transmissible as chicken pox and
Yes, that would
mhm.
be Delta.
Yeah, the Delta variant. Yeah. Yeah. Well,
Delta is 6 times more for every person that gets Delta, 6 or 7 people get infected. Vanilla COVID, the original one, 2.1% of people got infected on average. The
wow.
UK variant or Alpha COVID, somewhere around 3 to 3.2.
Wow.
So, so yeah, Delta is almost it's scary as hell because it's getting, and see, each time it spreads to a new person, it gets a chance to rearrange its genetics a little. It gets a
Mm.
chance to generate a new variant. And remember that things generated off a Delta platform are usually going to have Delta's attributes and then something extra. So we're running the risk of creating an entirely new disease with this, one that bypasses all vaccines, and we have to start over again.
Oh, child. Dr. Tiff, it's been a wonderful conversation today. So what would be your what message would you like to send to our listeners that are supporting us today regarding COVID?
Every one of us can actually fight this, okay? Not just by doing social distancing and all that. If you're supporting us, you likely already do that anyways. But look, when you see things that have good information on it, share it, okay? We need to fight this disinformation. We need to fight this, all of this snake oil and voodoo treatments that people want to do instead of dealing with the problem and just getting, the vaccine or using evidence-based medicine. Okay, so the counter to misinformation is resharing true information. So when you see posts or videos that logically and well explain something, share that, okay? Make that known. Send it to all your contacts too, not just the ones that believe like you, okay? Yes, maybe, there may be a little friction, but we all can do our role to fight this. We don't have to let insanity win. We don't have to let misinformation, and which is truly evil at this point, we don't have to let that stand.
Correct.
All of us have our voices together is louder than them. There are more good people than there are bad people driving that stuff. So, choice is yours.
I agree. Wonderful, wonderful message there. We have a comment for Dr. Tiffany. Wanted her to see. Dr. Tiffany, keep yourself safe as possible. That's Raven Black 08. Thank you, Raven, for that wonderful comment. You all, it's been a wonderful tea talk tonight. Dr. Tiffany, I sure do appreciate you making the time. I really wanted to educate my followers, put something out there in the atmosphere for other people to possibly run across regarding COVID with a medical professional that has seen things firsthand. And I really appreciate you for coming on. I want you guys for more videos like this where she educates and informs. And she does more than just medical stuff. She does other things too. You guys can follow her on TikTok at Tifftastic78, right?
75. Tifftastic
75. Tifftastic75. So you all go and follow Dr. Tiffany Najberg because I swear she does some really good content and very informative. And also we can keep the positive vibes as she goes into working in this surge and all of that. Keep some positivity around her, our medical professional at large. And I really appreciate you, Dr. Tiffany, for coming on. And then tell them again about Urgent EMS. Please do that again.
Urgent EMS, we do both acute care and primary care, and we do take walk-ins. I won't send you to the ER with obviously minor emergencies like a lot of urgent cares do. And we are located in downtown Shreveport at 401 Market Street, the American Tower Building, Suite 977. Come see me. I'd love to meet you and fix whatever problem you got.
Thank you so much, Dr. Tiff, for coming on. I really, really appreciate you. And I hope that you'll come back again. I know you're going on to another work stretch, but maybe you'll come back again and we can talk about the other things that I want to talk about. My children are going crazy back here. I know y'all hearing scream. So we'll talk about the other things that we want to talk about the next time around. I really appreciate you for coming on, and I hope you have a good night.
You too.
Thank you, Dr. Tiffany. Thank you all for joining us here in the comments. We really appreciate you all. And y'all come back again. I may upload some stuff later, but I'm not sure. But thank y'all so much, and make sure y'all like and subscribe if you have not. Thank you. Have a good night. Bye.